One of the medical treatment decisions that most people admitted to an American hospital, and almost every person admitted to an American hospital with serious illness, one of the treatment decisions that is discussed is cardiopulmonary resuscitation, or CPR. One of the things we know is that most people, A, don't have a good understanding of what CPR is, B, when it's indicated, and C, what the outcomes are. So let me address all three of those. CPR was a procedure that was developed to help restart a person's heart in the setting of a heart attack or another acute event. And in order to be effective, CPR involves pushing on the chest, and typically pushing hard enough that ribs are broken, in order to mechanically pump the heart blood through the body. It involves putting a tube into one's mouth, down into one's lungs, and onto a machine to artificially provide oxygen, essentially so a machine breathes for you. And because the heart is electric, oftentimes when it stops, it's because of an electrical problem. And we try to reset the electricity by putting two paddles on the chest and sending a shock wave through the heart, essentially to jumpstart it. That's what CPR is. It's compressing the chest, typically hard enough that you have to break ribs. It's putting the person on a breathing machine so that machine breathes for them, and typically involves medications and shock. Now, if the likelihood that my heart is going to restart and I am going to come back to a quality of life that I find acceptable, absolutely, it's clearly indicated. If I were to suddenly drop in front of you because I was having a heart attack, I would like you to begin CPR as quickly as possible. However, CPR will never return you back to a state that is better than what happened before it started. And when people die, the heart stops. So in the setting of advanced serious illness, when somebody is dying, restarting the heart, more often than not, will bring somebody back to what they might consider to be a fate worse than death. In the setting of advanced cancer, in the setting of advanced lung disease, in the setting of advanced heart disease, typically what happens is that we can restart the heart, but we don't restart the brain, and we don't restart the legs, and we don't restart the lungs. So that oftentimes in the setting of serious illness, when CPR is applied, we bring somebody back to a state where they have to live in a hospital for the rest of their life. They're attached to a breathing machine for the rest of their life, and they can't think clearly and recognize people. In that setting, survival to leave a hospital or leave an institution is about 1 or 2%. And most people would say, I don't want that. So when we talk about CPR, it's really important not to talk about the treatment, but to talk about the likely outcome that happens after that treatment. So for somebody with only heart disease, or somebody who is relatively young and healthy and perhaps is going through surgery, or for somebody who has curable, treatable cancer, or cancer for which they may have a very, very long life expectancy, then the likelihood of surviving a heart attack or the heart stopping and CPR is probably pretty reasonable. For somebody with advanced dementia, advanced heart failure, very advanced lung disease, cancer, the odds of surviving to a state they would consider to be good quality of life is almost zero. And the question that I ask my patients and my families is this treatment consistent with what your goals are? And recognize that if that treatment is applied, it's a pretty violent procedure for people to watch. Some of my colleagues talk about putting the patient through that. Anybody who goes through CPR is unconscious. They don't feel it. So what we're talking really about is, are we providing a treatment that's going to bring them back to a state they would consider to be a fate worse than death? And what are we subjecting the family to in terms of watching? And are we, by doing this type of medical treatment, preventing the family from having a peaceful goodbye? And those are the questions that I typically think about when I'm talking to patients and families about this treatment decision.